Hello and welcome to SRG's Medicine. Today, in this video of Respiratory Medicine Series, we shall be talking about dyspnea. So, the contents of this video are definition, overview of respiratory control, mechanism of dyspnea, general tips, and concluding this video by summary. Let's start with definition. Now, I'd like to mention that this definition which I've quoted here is from the American Thoracic Society, and it says that dyspnea is a subjective experience of breathing discomfort consisting of qualitatively distinct sensation, which may vary in intensity, and this experience derives from interaction among multiple factors that can be physiological, psychological, social, and environmental. Now, all these responses would initiate or may initiate the secondary physiological or behavioral response. Now, I have underlined few of the terms over here because these need further clarification, which I'll be doing towards the end of this video on the title General Tips. For now, let's move on to the overview of respiratory control. I'd like to tell that respiratory control, like other controls of the body, is also maintained via reflex mechanisms. So homeostasis is maintained by a reflex mechanism. And as all the parts of the reflex, here also there's presence of afferent, that is usually the mechanoreceptors, chemoreceptors, or baroreceptor present in the lung parenchyma, airways, or we could also say in the blood vessels. And this leads the impulses to the center. Now here the center is a respiratory center which is located primarily on medulla oblongata and also on pons. And this center now provides information or impulses to the efferent nerve. Now the efferent nerve would take the impulses to the effector organ. Now here in the case of respiratory control, the effector organ would be the respiratory muscles, primarily diaphragm. Now after that, the effect, that is respiration, if it is going on properly or not. Now these information are again carried by the afferent nerve to the center. Now this cycle goes on, and this is how respiratory control is maintained. However, there is an intruder or outsider. Now that in this case would be higher centers, because higher centers can influence both directly and indirectly on any of the part of the respiratory control cycle here, as we see. So this occurs specifically on the center and on the efferent nerve pathways. So we shall be clarifying our doubts about the mechanism of dyspnea based on the same picture. So the first location where the mechanism of dyspnea could take place is between effector and efferent. And that is what we know as increased mechanical effort of breathing, that mechanism. So we shall describe it now. So what is increased mechanical effort of breathing and how does it cause dyspnea? So if there's presence of any obstructive, restrictive, lung disease, or chest wall disorders, then these diseases will lead to the decreased ventilation, whether that be inspiratory or expiratory or both, based on this type of disease which it is. For example, in the case of obstructive diseases, there's more of expiratory ventilation decrease, whereas in the case of restrictive, there is decrease of both inspiratory as well as expiratory ventilation, and as such. So now these decrease in the ventilation is sensed by the lung, airway, as well as the chest wall mechanoreceptors. So once it is sensed by these mechanoreceptors, impulses are now sent to the respiratory center located at the brain stem and the sensory cortex located at the cerebrum. And once the impulses are sent over there, now there is increased outflow to the respiratory muscles. Now here, this increased outflow to the respiratory muscle would lead into increased mechanical effort of breathing, while simultaneously the impulses are also sent to the sensory cortex. And the impulses sent to the sensory cortex leads us to the feeling of chest tightness. So that is perceived by the patient as a feeling of chest tightness, or we could simply say a qualitative form of dyspnea over here. Now the next mechanism of dyspnea would occur between the afferent and center. And that is what we know as peripheral conditions producing compensatory tachypnea. So the conditions here would be hypoxia, hypercapnia, or acidemia. So these conditions, that is either decrease in blood oxygen level or increase in carbon dioxide level in blood or increase in the acidic components in the blood. Now, these would lead to sensation of these stimulus, that is hypoxia, hypercapnia, or acidemia, by the peripheral chemoreceptors, which are located in the carotid body, sinus, as well as in the pulmonary artery itself here. But the main thing or main chemoreceptors to be acting over here is carotid body. So main peripheral chemoreceptor would be carotid body. And these all react to all of these tumors, that is hypoxia, hypercapnia, as well as acidemia. But they act primarily against hypoxia, so blood oxygen level. So once these sense presence of hypoxia, hypercapnia, or acidemia, now there's increased rate of impulses to the respiratory center. Here I've mentioned increased rate because now these peripheral chemoreceptors are used for minute to minute or second to second control of the respiratory centers or respiration. So these usually send the impulses from minute to minute or second to second based on the location or requirement. And when there is a sensation of hypoxia, hypercapnia, or acidemia by these chemoreceptor, now their rate of firing increases. So when there is increased rate of impulses to the respiratory center, now that will result in increased efferent outflow to the respiratory muscles, that is the effector over here. Now, this will lead to compensatory tachypnea. But side by side, there's also the impulses which are sent simultaneously to the sensory cortex, and these impulses sent to the sensory cortex will result in feeling of air hunger, that is dyspnea. So now talking about the third thing that could happen, or third mechanism of dyspnea, that is the central mechanisms or central factors which cause compensatory tachypnea. Here, there's only a single central factor, and that is hypercapnia. So whenever there is hypercapnia, it leads to entering of carbon dioxide inside the CSF, and in the CSF, the carbon dioxide gets dissolved to form carbonic acid. Once carbonic acid is formed, it gets dissociated to form hydrogen ion and bicarbonate ion. Now, this leads to increased hydrogen ion concentration because as compared to the normal, there is increased formation of carbonic acid and ultimately increased formation of hydrogen ion. So when there's increased formation of hydrogen ion, now this is sensed by the central chemoreceptors, which are located in the nucleus tactus solitarius on the medulla oblongata. Now, once these are sensed by the central chemoreceptor, there's again increased impulses which are sent to the sensory cortex located in cerebrum, as well as in the respiratory muscles. Now, once the impulses are sent to the respiratory muscle, it leads to compensatory tachypnea. But the impulses sent to the sensory cortex will result in the feeling of air hunger or dyspnea. So let's talk about the fourth mechanism. So the fourth mechanism here would be the outside or intruder factor, or as we said, the influence of the higher center. Now that is what we know as psychogenic conditions. So on the presence of psychogenic condition, for example, anxiety or seizures or any other psychogenic conditions, we see that there is an increased impulses sent to the respiratory center from these higher centers. And once there is increased rate of impulses sent from the higher centers to the respiratory center, these impulses are simultaneously sent to the respiratory muscle, resulting in tachypnea. But side by side, when these motor impulses are being sent, the impulses also comes back to the sensory cortex. And when the impulses are being sent to the sensory cortex, now these are sensed as a feeling of dyspnea. So now let us talk about the general tips or the factors that I outlined before in the definition, the points. So the first thing that I outlined was subjective experience. So we have to say that dyspnea is a subjective experience because it can only be felt by the patient and not by the doctor himself or herself. So it is not seen by the doctor, unlike the increased work of breathing, whose signs and symptoms can be clearly elicited and seen by the doctor and measured objectively as well as subjectively. But here in the case of dyspnea, it is a symptom or experience which is felt only by the patient and cannot be measured objectively. Hence, dyspnea is a subjective experience. The second thing that I underlined was about the qualitatively distinct sensation. So why does it occur? Here, dyspnea occurs as a distinct sensation from person to person. So there's inter-individual variation because there are different sites of stimulation which acts as a sensory locus for dyspnea. So till now, we have not identified a single site for dyspnea sensation. but rather there are multiple different sites which acts as a sensory locus for dyspnea, thereby leads to different sensation depending upon the site. The next thing is that the information which arrives at the sensory motor cortex has different interpretation based on the psychological makeup or environmental situation of the patient. For example, let us consider a patient in a survival situation, or let's say in a wartime or battle situation. There, if the patient has some kind of gunshot injury and leading to pneumothorax or collapse of lung, and then the patient should be feeling dyspnea, but due to the adrenergic rush, or what we say the survival strategy or survival instinct, that the patient doesn't just sit there feeling dyspneic, but rather he or she work for survival. Now there, the feeling of dyspnea is suppressed. So that is based on the psychological makeup or environmental situation. But if that same patient, given the same wound, is kept on a calm and silent situation, then in such condition, the patient has an intense feeling of dyspnea. So that means that the information arriving at the sensory cortex has a different interpretation based on the psychological makeup as well as the environmental situation the patient is in. So that also gives us about our third point that we had said, that is there's interaction among multiple factors, like as we said, physiological, that is the basic mechanism, and then psychological factors, environmental factors, or social situation, or how the patient should be reacting. So such kind of things. So it is often multiple causes that are worked simultaneously for causing dyspnea. And the fourth point that we underlined over there was that it may induce secondary physiological or behavioral responses. Okay. The secondary physiological responses can be increased work of breathing, for example, pursed lip respiration, tripod stand position, or we could say cyanosis, we could say increased work of breathing by the accessory muscle use. So these are the physiological responses. And the behavioral responses would be unwillingness to perform outdoor activities. Here, these outdoor recreational activities would be initially liked or enjoyed by the patient. But once he or she starts having dyspneic episodes, then in such condition, the patient is unwilling to perform those similar recreational outdoor activities that he or she used to like earlier. So that may be seen. So it is not a must, but may be seen in a dyspneic patient based on the intensity or severity of dyspnea, so or in the condition the patient is in, or the social situation. So that's why we can say that multiple factors are again working over here to induce these responses. And the fifth and the final one general tip that I'll be talking about is that the central chemoreceptors responds only to the carbon dioxide level, but the peripheral receptors responds to oxygen, carbon dioxide level, as well as the pH. However, the primary response of the peripheral receptors are based on oxygen. For acting on carbon dioxide level or pH, there must be a large alteration in the level of these factors. So these are the general tips that I have covered in this video. So now concluding this video with the summary. Dyspnea is a variable subjective experience of breathing discomfort which occurs due to interaction among different factors. And dyspnea occurs via variable mechanism, and these include increased mechanical effort in breathing, peripheral and central conditions which produce compensatory tachypnea, and psychogenic condition. Hope you enjoyed it. Thank you. Please be sure to comment your feedbacks or any questions that you have. Thank you.